consent to vacate the quorum call.
Without objection.
Mr. President, thank you. And I want to start my remarks on health care and what's ahead over the next couple of weeks, this way. For almost 7 years before I got elected to the Congress, I was the director of the Oregon Gray Panthers, the senior citizens group, and ran a legal aid office for the elderly. And I made the judgment then, Mr. President, that health care was and always would be the most important issue. And I made that judgment because I've always felt that if you and your loved ones don't have their health, then pretty much everything else doesn't matter. And the President of the Senate, of course, is a skilled health care provider, knows a lot about these issues, and I'm really going to use that as my reference point today, taking the judgment that having quality, affordable health care for your family and yourself is paramount to everything else. My view is that the proposal being considered here in the Senate, cutting hundreds of billions of dollars in funds for the social safety net, the Medicaid program, the Lifeline for seniors and kids with special needs, and the disabled. That proposal is going to put at risk the health and well-being of millions of Americans if it's passed. And it's why I want to take some time to explain what it actually does, so that people all across this country will be in a position to make their voices heard, to speak up, do their part, so that when this debate comes to the floor of the United States Senate, as I believe it will in the next couple of weeks, and it moves very quickly, every member of this body is going to have heard loud and clear what Americans think of this proposal. And I don't think that assessment is going to be too kind. Now, the House passed their version of Trumpcare by a razor's edge, and to put it in a pleasant way, over here, senators looked at it and said, no way, no thanks. My colleagues in the Senate majority said, we're throwing this bill out, we're starting fresh, we're going to do it right. So I'm going to start with where that process got launched. The majority convened a special working group, 13 Republican senators, all of them men. And it turns out, based on comments that have been reported, that the Senate bill isn't going to be all that different from what the House was talking about. So Republicans in the Senate are pretty much picking up where the House left off on Trumpcare. And the legislation that's being crafted stays hidden, stays behind closed doors, and in a position where, for example, if you're a Democrat on the Finance Committee, you don't even know what's in it. It's not going before committees, won't be put forward for amendment in a markup. With barely any public notice, the bill will hit this floor for 20 hours of debate. That's that. And Mr. President, I will just briefly describe, we had a session in the Finance Committee this week, and there was discussion there from the other side of the aisle that maybe there was a big partisan divide with respect to health care. And I listened a bit, and finally I said, I don't know how you can have a partisan divide about a bill that you can't read. I'm the senior Democrat on the Finance Committee, the committee that has jurisdiction over hundreds of billions of dollars in payments for Medicare and Medicaid, the various tax credits that are part of the Affordable Care Act. This is the committee with the authority to address the management of hundreds of billions of dollars for those programs, Medicare, Medicaid, tax credits. And we've seen nothing. Nothing. Not only have there been no hearings, we haven't seen anything. If something has been sent to the Congressional Budget Office, who knows the answer to that? We haven't seen that either. So that's the process that would dictate a radical transformation of a sixth of the American economy, the American health system, affecting millions and millions of Americans. Now, that's what we're looking at right now for the next couple of weeks. And it's pretty different than what happened during the Affordable Care Act. I want to focus on a few points just with respect to that. The first is especially important, as I've said, to our committee, the Finance Committee, that deals with Medicare and Medicaid and these crucial aspects of health care in America. The Senate Finance Committee has been cut out of this process. The chairman, Senator Hatch, I, and 24 other committee members, there's been nothing for us to examine as a group, do what the Finance Committee tries to do best, which is to work in a bipartisan way. That's what we have done so often in the past, to sit down, try to take the good ideas that come from both sides. There's staff that knows health care inside and out, years of experience working on health care matters. And I've got a little bit of a special interest in this because I wrote something called the Healthy Americans Act, Mr. President, before you were here in this body. 8 Democratic senators, 8 Republican senators joined together in comprehensive health reform. First time ever before. We've done a lot of good work on issues that represent the big challenges ahead. We know, for example, Medicare today isn't the Medicare of 1965. It was about broken ankles, Part A, or Part B, a bad case of the flu. Today, Medicare is about chronic illness, diabetes and heart disease and strokes and cancers. We've worked on that in a bipartisan way. Bipartisanship is what the Finance Committee is all about. So in the run-up to the Affordable Care Act, we held more than 50 hearings, roundtables, walk-through sessions. Weren't exactly exciting. We always used to say, if you're having trouble sleeping, come by for a while, you'll be knocked out in a matter of minutes. But that's where you do the hard work of legislating. And when the Finance Committee finished the drafting process, the legislation sat online for 6 days before we went through the formal committee consideration, what we know up here is a markup. A total of 564 amendments were posted online before the markup began for all to read. The markup lasted 8 days. 130 amendments in the longest markup in 22 years. 24 Republican amendments were adopted, and the bill passed with a bipartisan vote. We all got pretty sick of the hearing room by the time it was over, and I just would read a quote from Senator Grassley with respect to the Finance Committee markup of the Affordable Care Act. Now, Senator Grassley is the chairman, of course, of the Senate Judiciary Committee, former chairman of the Finance Committee, and a very careful, thoughtful legislator. He said, and I quote, that this was the most open and inclusive process the committee has undertaken in its history. And he went on to say, I believe since I've been on the committee. So that's not a Democrat. That's Senator Grassley, the chairman of the Senate Judiciary Committee. And I'm sure Senator Murray has similar accounts of the process under the late Senator Kennedy. That legislation was online for days as well. That's what the legislative process is supposed to look like. It's a process that starts from the bottom up, and it is out in the open. Sunlight has always been the best disinfectant. You get hearings, you get study, you get debate, you marry the best ideas of both sides. I've always felt that bipartisanship is not about taking each other's lousy ideas. Bipartisanship is about taking each other's good ideas. But because of the process that the Republican leader is insisting on, that is not what the majority has on offer. What's in the works, hidden away, so that the public and Americans across this country who might be sitting in a coffee shop and would like to pull up a proposal on their laptop, they can't do it, and there aren't any hearings on what might be going as well. That, in my view, is the wrong way to build a sweeping, massive proposal like this, which for so many of those who are walking on an economic tightrope, balancing their food against their fuel and their fuel against their medical care, this isn't some abstract issue for them. It's a matter of life and death. Now, this proposal is built around an attack on Medicaid. The last version of the bill that anybody's been allowed to see cut the program by more than $800 billion. But there haven't been any hearings on what that would mean for the 74 million Americans who get their health coverage through Medicaid. Nobody has been brought before the Finance Committee to talk about how you would not endanger the Medicaid nursing home benefit with this proposal. And that benefit pays for 2 out of 3 nursing home beds in America. There hasn't been a hearing examining the effect of the staggering implications of Medicaid cuts on 37 million kids enrolled in the program, particularly what it means for kids with disabilities and kids in special education classes. At home in Oregon, Mr. President, when we had town meetings and roundtables on it, and I just raised the issue very gently about the prospect of those special needs kids being hurt with this proposal. And the room just broke out in sobs. There haven't been any hearings on how much worse the opioid epidemic will get in states across the country when people enrolled in Medicaid lose access to treatment for mental health and substance abuse disorders. And just this morning, Mr. President, I talked about a brand new idea that seems to be picking up some interest in the majority about basically coming up with kind of a separate way to fund the coverage for opioids. Instead of it being a guarantee of being able to get access to services, it'd sort of be a separate program, which also is not in line with sensible health policy. As the President of the Senate knows, so often those who are addicted to opioids have multiple conditions. In other words, if you're a young person who's addicted to opioids, you might well need mental health services. If you're an older person who's addicted to opioids, you might need services relating to chronic illness. So I want everybody in those states across the country, particularly in the Midwest and in the industrial Northeast, although opioid addiction has hit this country like a wrecking ball from Portland, Oregon to Portland, Maine, but there are a lot of people paying attention to what's going to happen with respect to coverage for those addicted to opioids. And based on this proposal that I've been reading about as being floated, this is a prescription for trouble for those trying to come back from opioid addiction. Then I want to mention the bill's provisions on pre-existing conditions. When the Affordable Care Act was written in committee, the bedrock guarantee of protection against discrimination with those who have pre-existing conditions and protecting those who have pre-existing conditions with airtight, loophole-free protection, that was at the heart of the Affordable Care Act. My view is Trumpcare takes a jackhammer to that bedrock protection, cracking open loopholes that benefit insurance companies. And Americans are aghast that their elected representatives would support the idea. I know that because I've had 46 town hall meetings in my state this year, and I hear about it at nearly every one. So you would think this would generate a lot of interest in the Senate Finance Committee, the committee with jurisdiction over Medicaid, for example, because there are a lot of those folks who have pre-existing conditions. No discussion, Mr. President, zero discussion, zero of any proposal that the Senate could be considering in the next couple of weeks that rolls back protection on pre-existing conditions. And I gather that the House bill just basically takes the waiver process, which in the Affordable Care Act was designed to let states do better. In the House, they let states do worse, considerably worse, and one of the most objectionable features is the states could get a waiver and unravel some of those strong protections for people with pre-existing conditions. Now, Trumpcare also, if the health changes I've mentioned aren't bad enough, what it does is it takes hundreds of billions of dollars of health care from needy and vulnerable people and, in effect, hands it in tax breaks to the most fortunate. Nobody has come before the Senate Finance Committee with authority over taxes to explain why the United States Congress ought to raid health care programs for the vulnerable to fund tax cuts for the fortunate few. Our committee, the chairman and I, along with all the Democrats and several of the Republicans, have been prevented from legislating out in the open on this proposal because the Senate Trumpcare plan has essentially been pushed out of view. And it's clear this isn't just sidestepping the Finance Committee. The public, the American people, have been cut out of the process when health care policy that will affect millions for years to come is being written here. The majority leader has said that he's pretty much not interested in input from Democrats. The Republican health care plan is going to move by reconciliation. That's a Washington word, folks. You know, when you're at a coffee shop, nobody's talking about reconciliation, but it's basically our way or the highway. We're going to do it our way, and that's that. It is the most partisan road you can go down the Senate. It relies on moving as quickly as possible with the least possible sunlight. And as far as I can tell, this Senate bill is going to be hidden until virtually the last minute, at which point it would come straight to the floor for a very short, abbreviated debate. That's not what happened when the Affordable Care Act came up. The Senate spent 25 consecutive days in session on health care reform, second longest consecutive session in history. Week after week, spirited debate, mid-November into late December, vote after vote after vote. In total, the Senate debated the Affordable Care Act for nearly 220 hours. That kind of extended give and take from both political parties, you just can't have under this partisan our way or the highway approach known as reconciliation. When the Senate plan hits the floor, there'll be 20 hours of debate before time expires. The final votes are cast. That's it. That's it. We won't have seen a bill until the last minute, And then 1/6 of our economy is going to be handled and framed for decades to come in a short and regrettably partisan debate. Mr. President, I have said from day one that the Affordable Care Act is not perfect. No major piece of legislation it ever is. For major legislation to work and for it to last, it has to be bipartisan. And that's why I've mentioned, I put in a bipartisan bill, 8 Democrats and 8 Republicans. But you don't get it exactly your way. So I was very glad when the Affordable Care Act took that portion of our bill, the portion of the bill that had airtight, guaranteed protection for Americans from discrimination when they had pre-existing conditions. And the reason we felt it was so important, Mr. President, the 16 of us, 8 Democrats, 8 Republicans, is if you open up the opportunity for discriminating against people with pre-existing conditions again, you take America back to the days when health care was for the healthy and the wealthy. That's what happens if you allow that discrimination. If you're healthy, no problem. If you're wealthy, no problem either. You can just write out the checks if you have pre-existing conditions. But the process the Senate is headed down now is as partisan as it gets. And unfortunately, what the Senate Republicans are doing now makes what the House was up to almost transparent. So I'm going to close here with just one last comment. Now is the time for the American people to get loud about health care. Really loud. Because the well-being and health of millions of Americans is at stake here in the United States Senate over the next 2 weeks. For older people who could need nursing home care, for seniors who aren't yet eligible for Medicare between 55 and 65 and could face huge premium hikes, for the millions who work for employers who thought they were safe, and the House bill removes the caps on the out-of-pocket expenses they have. Well, let me tell you, Mr. President, somebody gets cancer in America, and they bust those caps in a hurry. And yet that's what the House was willing to do, and I don't see any evidence that the Senate is willing to change. So this debate didn't end when the theatrical production on the South Lawn of the White House took place a few weeks after the vote in the House of Representatives. So my hope is, and I sure heard about it from Oregonians last week when we had 4 town meetings across the state, there's concern, there's fear, and there's frustration about why they can't be told what's in this bill. There is still time for Americans to make a difference, because political change doesn't start from the top and go down. It's bottoms up. It's not top down, it's bottoms up. And there's still time for the American people to be heard and make sure that their senator understands how they feel about this, what's at stake, and in particular, get an explanation about why they can't be told now what's in this bill. Mr. President, I yield the floor.
Okay. Mr. President.
Senator from Texas, the Majority Whip.